Welcome to the Midland Moment Podcast, a podcast dedicated to telling the story of Midland through the eyes of its employees. I'm your host, Jeremy Wiltz. With me today is Cheryl McIntosh, therapy coordinator for our PACE program. Welcome, Cheryl.
Thank you so much for having me.
We're really excited to have you on today. We're really excited to explore PACE and especially the therapy side of PACE. Cheryl is a PT and so am I. And so that's a super fun connection that we have. And so, Cheryl, I just want to start a little bit with, if you could tell us a little bit about what your job is within the PACE program.
Absolutely. So I'm the therapy coordinator, like you mentioned. I oversee the therapy departments in both Topeka and Emporia. That includes working with physical therapy, occupational therapy, and our wellness team.
Awesome. And so for those that haven't been over to our PACE buildings or haven't seen it, can you describe what the therapy program looks like in PACE and how we strive to keep people at home?
Absolutely. Our goal, of course, is to keep our participants safe in their home. Living in the community always increases their quality of life. So our physical therapists and our occupational therapists, they're occasionally in the home, in the facilities, even sometimes in the hospitals, assessing our PACE participants, also just seeing them at the centers, and setting them up for whatever they need, whether that's physical therapy, occupational therapy, getting all the equipment that they need, or even our wellness program. Our physical therapist assistants, occupational therapist assistants, and our wellness team members all pretty much work within the PACE Center, occasionally in facilities, just helping our PACE participants reach those therapy goals.
And for those that don't know exactly about the PACE model of care, it's the Program for All-Inclusive Care to the Elderly, which means that we are completely responsible for that patient's health care. And there's a term that gets thrown around. And those of you listening that are in PACE, this will seem like second nature to you. But could you tell me a little bit about the IDT team in PACE and what their involvement is in the PACE program?
We have 11 members on our team, everything from transportation, our center administrators, our social workers, our nurses, our therapists, our dietitians, home care coordinators. So we have wraparound services. All of our IDT members meet every morning. We review any on-call notes, hospitalizations, everyone in facilities. We complete any huddles. So we're constantly working together to coordinate care to improve the services that our PACE participants receive. It's great compared to anything in the community. We're all housed within the same building. We all have access to each other. And so we're just able to provide excellent services for our PACE participants.
And I think that's so crucial because if you look at the cross-section of participants that we treat, it's really those that are at most risk in our community to fall through the gaps. And so it's such a cool program. And you've been doing this, as we were chatting before, you mentioned for 7.5 years. So what brought you to Midland to that 7.5 years ago? What made you feel like Midland was a place that you wanted to work?
The older I get, the older my parents get, my grandparents, my husband's grandparents. It just became more and more of a passion to me to help older adults age in place. So Midland Care was a perfect setting. I had a physical therapist friend that was already working in the PACE program and kind of kept encouraging me to come check it out. So I did. I came over and visited the PACE program. I was really impressed with the services and just the quality of care that the PACE participants were receiving.
So now you've been here for 7.5 years and, I've gotten the opportunity to sit in meetings with you and we've planned for the future and we've talked, and I've always been really impressed with your ability to put patients first and really exemplify the values of Midland. Could you share with me maybe something within your career, whether it's a story of a patient or just a theme, within Midland that makes you feel like this is a place that really is on mission?
Yeah, we get some PACE participants that don't have any family members or they don't have any advocates for them. Those are the people that really fall through the cracks when they're out in the community on their own. And those PACE participants really rely on us for everything, not only their medical care and services, but we become their PACE family. And it's really touching because we get to know their stories. We get to know their pets. We get to know their likes and dislikes and what motivates them and encourages them. And so I really look forward to coming here. I love building relationships with the PACE participants and just giving hugs occasionally. It's just a joy for me to walk around our center and see our PACE participants engaged in the activities we have with the other PACE participants, working hard with my therapy team. We're all working towards the same goal, and that's to keep our people safe in their home.
Yeah, I think it's super exciting as I was coming in today, and you just see all the bustle and the activity of people coming and going after lunch and all the activities going on downstairs. It's a really fun environment, and it really does feel like a family. And I think that's super exciting. So as you look forward, obviously there's lots of fun stuff going on in PACE. PACE is kind of on the leading edge of this all-inclusive care and us taking on a whole patient and really trying to treat a whole patient. What excites you about the future of Midland and where we're going?
Well, touching more lives. So the new PACE program that'll be opening up in the Kansas City area is just super exciting. We'll have the opportunity to serve more individuals in that setting. But also on the other end, Emporia, just growing that PACE program. We've really grown it a lot. Our participant number has increased. We've increased staffing there and building a stronger therapy team there. So I'm just super excited about reaching Kansas City, but also the more like rural communities and in Emporia.
Yeah, I think those are two really, really cool things, because in Emporia, we've seen something that we haven't really seen anyplace else, that as a percentage, we have a much higher group of people coming to Emporia than what we actually expected when we built the center and opened the center and all of that. So that's super exciting. And for those listening that don't know, we are going to be adding 3 more counties: Johnson County, Miami County, and Franklin County, to our PACE services. And we'll start hopefully sometime in 2024 looking to enroll patients with a PACE center completed sometime in 2025. So super exciting stuff. We're really excited for what the next steps are. So I always kind of wrap up the podcast with an unexpected question, which I know you're going to love. But so my question to you, just to learn a little bit more about Cheryl outside of PT Cheryl, is when you were a kid, what did you want to be when you grew up?
I actually wanted to be a vet. So I worked for a vet for 4 years. I decided it really breaks my heart to see animals hurting and in pain. And, you know, a physical therapist is constantly torturing our patients. And I mean that in a joking manner. I love animals. My dog just had surgery. I've gotten to do physical therapy on her, which has been fun. But it's really the relational aspect of working with people. That's what got me into physical therapy. I didn't want to see people on rare occasions treating illnesses. I wanted to be able to work with them, celebrate their successes and their wins with them, help them to be at their highest level of function. And I've gotten to do that, and it's just been a really successful career.
I think that's super cool to see how one career has kind of led into another and how they feed off of each other.
Yeah.
Well, Cheryl, thank you for joining us today. And we're so grateful to have you as a part of the Midland family and for what you do for our patients every day. And for those listening, thank you for tuning in, and we'll talk to you soon.